So, as Johan said, my name is Helena Nordenstedt, and I'm an assistant professor in global health. What does that mean? It means I teach global health, normally to students at Karolinska, and lately also to students all over the world in a web-based education in global health. And as I was preparing this speech, I thought a lot about the title, Global Health in Fragile Environments. What does that mean? How can health be global in fragile environments? So I decided, it's a bit simple maybe, but I decided to change the title to Fragile Environments and Global Health. And this year, even this month, is a very special month. It is for the first time ever, the World Bank has decided to quit using the definitions developing and developed. They are not dividing the world into two parts anymore. It's not us and them, as many of us used to think, maybe. So we're going to talk about categories today. And this is what the World Bank said on their blog, that we're no longer distinguishing between developing and developed countries. And if you go into their websites and you look into categories and see what they have now, they only have the different countries and the divisions into geography and income. There's no more developed and developing categories. On the other hand, other organizations like the UN, this is from the UN Statistics Division, they always had a little footnote. There is no established convention for the designation of developed and developing countries of areas in the United Nations system. So this is what I do when I teach. We start by giving the framework. The framework no longer uses developed and developing. Going back to definitions and categories. What is a fragile state? I think most of you have a concept of what a fragile state is. But also here, there's a problem with definitions. You can use the World Bank's harmonized list of fragile situations in 2015, which takes into account 33 countries, or the Fund for Peace Fragile States Index, which has 38 countries. Or if we go on to the OECD States of Fragility Report, which has all these different dimensions, you have 50 countries. Or the International Dialogue on Peace Building and State Building has 20 countries. That is the international dialogue that held a conference in Stockholm in April this year and launched the Stockholm Declaration. And this, the International Dialogue on Peace Building and State Building, these 20 countries, these countries have chosen to be part. So they have chosen to be part of these fragile states definition. It is led by two people. It is led by the minister of, let's see, the Prime Minister from Sierra Leone and our own Isabella Lövin. So, categories. I never thought I would be using the Gapminder in front of Hans Rosling himself, but this is Gapminder. And this is the main graph. You have seen it before, but let me take you through it again. Each bubble is a country, and the size of the bubble is the size of the country. Big bubble means big country. It's quite easy if you look at India and China. Big red bubble means big Asian country. And so the color also then means region. The blue countries are the African countries. Yellow means Europe, and green is Americas. On the horizontal axis, we have income. On the vertical axis, we have life expectancy, which more or less is health. How long do people live in a country? And as you can see, there's a clear trend that the richer people are, and the richer the countries are, the healthier people are. And if someone wants to say that there is no relation between income in a country and health, just take a look at this graph. And another thing, if you start looking at it long enough, you start wondering, this corner is quite empty. There are no countries that are rich and that are not healthy. And the opposite, there are no poor countries that are healthy. It looks quite clear, doesn't it? So now we're going to continue with definitions, and I will use the World Bank income categories, meaning we have first the high-income countries, where 1 billion people live, And up there in the corner, I cannot reach, I'm too short, you have Sweden. You have the big green bubble, which is the US. And then we have the upper middle income countries with another 2.5 billion people. And that's where China is. Then we go on along the income scale so to the somewhat poorer countries, and we come to the lower middle income countries with another 2.5 billion people, where you can find India. And finally, the low income countries, where you can find a country like the Democratic Republic of Congo. Then if you look closely at these different categories, within each category, the relation between and health outcome is not as clear, is it? They do look, here there's not a straight line. So within each category, maybe actually health policies and health systems, what you spend your money on is quite important within each category. And it's the same in all the different countries. In all the different categories. And we can also take a look at the average life expectancy in each category. You see it's 59 in the low-income countries. It's 67 in the lower middle-income countries. 74, you have some countries here like Angola and South Africa pulling down the average. And finally, the high-income countries with a life expectancy of 79. So 59 to 79 is the range in the world today. The world average is 71. Now we have looked at how health and income go together. Let's look closer at health. How do we measure health? How do we measure diseases? Maybe what you think of first is, well, the easiest way to think is number of deaths. How many people die in each country? How many people die from a certain cause in a country? The number of deaths. But number of deaths, I have bad news for you. You're all going to die. It's not a very good measure to use. So, and also, it doesn't make a difference between if you're a 27-year-old mother who dies in a traffic accident or a 97-year-old dying from heart failure. A death is a death. So instead, we use something we call burden of disease, or disease burden, and that is made up of life years lost. And not only life years lost, but also healthy life years lost, meaning that we take into account diseases that do not cause death. Depression, back pain, mental disorders. Let me show you that in another way. Can you imagine that this box is a full, healthy life? This might be your life. How many in here are feeling fully healthy today? You are? Are you sure? No back pain? No? Did you sleep well? So on this axis, you have health, full health, up to there. And on this axis, years, up to the standard life expectancy, a full life. And then if you're hit in a car accident at age 30, and you have a hip fracture, you have to use crutches for maybe a year, you have some complicated surgery, and you cannot really walk, then you will lose some of your health for a short period of time, and then you're back at full health again. Then maybe at age 60, you have a stroke instead, and you cannot move your left arm and leg, and become paralyzed on your left side. Then you will be permanently disabled for the rest of your life, and you lose more health, or more healthy years. And finally, maybe at the age of 75, you die early from heart failure. So all these gray areas, or striped areas, are the healthy life years lost, or DALYs for those of you who use them. And if we take them together, we build them together for different people and for a country. We build all the health lost, and we make them into a disease burden box. And then we want to look closer into what makes up this disease burden. You remember we had the traffic accident, we had the heart failure. What makes up this box? Sorry, wrong way. Well, we're going to categorize again. So the blue box are the non-communicable diseases. This is the global disease burden box. So the disease burden of the world today. And you see the blue box is the biggest, and it contains the biggest cause of disease and death in the world today, cardiovascular diseases. It's here. Then we have cancer, respiratory diseases, and diabetes. They all come into the non-communicable diseases. In the pink box, we have infections. We have all diseases related to maternity, to pregnancy, to newborn health, to nutrition. And finally, injuries, the small green box. And you can look this up on the website of the Institute of Health Metrics and Evaluation. And you can go in there and you can make these boxes for all different countries, for different age groups. You can go into more detail and you can see exactly what disease burden is in which country. So now, if we take this box and we put it into the big graph where we saw how health and income relates to each other, when I have done that, you will have learned as much as my students normally learn in a year in the master program of global health, or in 5 weeks in another course of global health at Karolinska. So, but you'll get it in 10 minutes. I think you're an audience who can take that. So let's put it into our graph here. The disease burden. You remember blue, non-communicable diseases, or NCDs. The red one for infections, plus, and injuries, the green box. Infections plus diseases related to pregnancy, nutrition, and the newborn period. So if we build them into here, you see that in the high-income countries, the blue box is huge. That is what causes most diseases and early deaths in our part of the world, in high-income countries. If we continue along the income axis, you see the blue box becomes smaller and smaller and smaller, and in low-income countries, the red box is clearly dominating. The problem with this, or the problem, but inherent in this, is that it's relative. It doesn't say anything about the size of the disease burden. So to talk about size, I chose one measure, and that is maternal mortality, maternal deaths. And normally we see that the biggest number are always in the low-income countries, the biggest numbers, the biggest staples. But instead, I'm going to do it the other way around, and we're going to talk about lifetime risk of maternal death. 1 out of 3,300 girls aged 15 in high-income countries will die in pregnancy or childbirth. 1 out of 3,300. If we continue in upper middle-income countries, it's 1 out of 970. We continue to lower middle-income countries, 1 out of 130. And then in low-income countries, it's 1 out of 41. And it might seem horrible to talk about something as terrible as a maternal death with just these little people and statistics and numbers, but we have to show it somehow. And this is quite telling, I think. Then we need to remember that within each category, there are big differences. So we can go more into detail, and I know that Anders Nordström will later talk about maternal mortality in Sierra Leone, but in Sierra Leone, 1 out of 17 15-year-old girls will die in a pregnancy or childbirth-related event. 1 out of 17. And then we also need to remember that things can change, and sometimes they change quite quickly. Let's take a look at the disease burden for children under 5 in Sweden. And you see that it's the red box is bigger than for, if you take all of Sweden, then the blue box is much bigger because we have a lot of old people dying from strokes and heart diseases. So the red box is a bit bigger. And if we compare this is in 2010, if we compare this to Syria, it's not that big of a difference, is it? But it's 2010, and things do change. So this is Syria in 2013, the latest year that we have data. And if we dig deeper into it, most of this green box is war. So things do change. So we need to dig deeper in to look at each country and also see how things change. Let's go back to the graph again. I think now you're quite familiar with it. We're here to talk about fragile states. Where are our fragile states? That's 14 out of the 20 in the international dialogue, fragile states. 14 of them are low-income countries. and 6 of them are lower middle income countries, as you can see. So 14 out of, and there's no countries whatsoever in the upper middle income countries or in the high income countries, no fragile states out of those 20. 14 out of 31, almost half of the states in the low income country group are fragile states. And 6 out of 51 in the lower middle income countries. So our fragile states are in this corner. Now I've been quite serious for some time. Let's look at some more positive news. I'm sure you're all aware of what has happened to poverty in the last decades. This graph shows the total population growth in the last 2 centuries. You see, we go from 1 billion people up to all of 7 billion people today. These are the number of people out of the total population living in extreme poverty. So you see, in the beginning of the 19th century, almost all people were living in extreme poverty. There were almost no exception. A few people maybe there in the UK and the Netherlands. And then as the population starts growing, the number of people living in extreme poverty started growing. It kept on growing and growing, not as fast as the total population, but kept on growing all the way until the 1970s, when it started to go down. And then this has happened. While the population has grown and grown and grown, the share of people living in extreme poverty has really decreased. And we're, for the first time in history, down to 10% of the total population in the world living in extreme poverty. 10%. And you remember over there, as you see, that's more than 90%. And we're down to 10%, despite the total population, or maybe thanks to the population growth. So to reach the Sustainable Development Goal 1.1, we need to do something about that last part. It looks like it's just going to continue and go down maybe until 2025, 2030 something. But those last 10% are, as always, the most difficult 10%. And as this graph shows, I'm a teacher, so I'll have to look at some graphs. As you can see, the people living in extreme poverty going down globally, but for those living in fragile states, not much has happened. The number of people is about still the same in fragile states living in extreme poverty. So these will be the last 10%, and reaching those in the fragile states is the only way of reaching goal 1.1. Thank you very much.
Thank you very much, Helena. Before you step off, for starting off where you ended, what is the key for reaching those 10%?
The key is, a little bit like I tried to show, that you need to dig deeper and look at each state by itself, and you need a state. You need someone to provide the solution, someone to provide the healthcare, someone to pay the healthcare workers. You need a state that is not fragile, and you need to look at each state individually.
So one of the things that we're going to try to do here is to try to sort out what is the actual problem. And Helena now helped us of defining it. And then the rest of the day, we're going to start talking about how do we actually solve this. And that's why we're so happy that we have the State Secretary to the Minister of Development Aid, Ulrika Moder, who have a keynote here of trying actually to lay out the path forward, which is a top job after Helena laid out all of the difficulties, but also showing some glimpse. But as I said in the introduction, our aim here is really to put focus on those who are the most vulnerable and those who are the most difficulties. So thank you very much, Helena, for laying out the groundwork.